I said, please can we go see doctor? Something's just not right.
Then there were a lot of words like incurable, rare, no known cause.
When you hear that your friend is going to die, it's just something that you can't comprehend.
I knew that I was in a situation that was desperate. I needed help, and I needed it now.
I thought, if he has something that cannot be helped, what are we going to do?
Next, two medical mysteries that defied the experts. 29-year-old Sean Kiefer can't wait for his son to arrive. But just weeks after the birth, he wakes up almost paralyzed, leaving doctor after doctor scrambling for a diagnosis.
It was extraordinarily depressing to want to bend down and pick up my son, knowing that I wasn't able to move.
Then, when 12-year-old Kirsten Larson is told that she has to lose some weight, she diligently begins an exercise regimen. Little does she know that it could have deadly consequences.
His face turns white. He says, I don't know what it is. This isn't good.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the fall of 1997, Sean Kiefer was at the top of his game. Already the star of his tennis team at Indianapolis's Hillsdale College, he couldn't wait to get going on his junior year.
I had a very normal life, very active. I played all sorts of sports.
Sean was always extremely active. He was the first one to climb a tree. He was the first one to hop over the fence.
During the month of September, Sean is spending more than 10 hours a week out on the tennis courts. He seems to be unstoppable until he wakes up one morning and notices a strange feeling in his eye.
I felt a lot of pressure on my eye and a sharp sensation, and so I went to the general practitioner, and he immediately said that it was pink eye, conjunctivitis, and that he gave me some medicine and said that should take care of it.
Sean diligently follows the doctor's orders for the next week, but the drops don't seem to be working. In fact, his eye appears to be getting worse.
I felt a large scratching sensation, and the pressure in my eye was increasing in pain.
The pain is so bad, he's having trouble focusing. So he makes an appointment with an ophthalmologist, hopeful that he'll find out exactly what's going on.
He immediately noticed that there were aberrations in my eye, and he knew that it was not pink eye, and he told me that I had something called uveitis.
Uveitis, an inflammation of the middle layer of the eye, can be triggered by a number of different medical conditions. It's almost always treatable, but can result in severe and permanent vision loss if not managed properly. The doctor gives Sean a prescription for steroid drops and instructs him to use them whenever he has a flare-up. Over the next year and a half, Sean experiences a few more uveitis attacks, but successfully treats them with the prescription eye drops. Then, in 1999, during the second semester of his junior year, Sean is accepted into a study abroad program in Spain.
He was going by himself to a place that he had never been, but he was extremely excited about it.
Sean is having the time of his life, when suddenly, his trip abroad turns into a living nightmare. He wakes up one morning with an extreme fever that won't go away.
And I would be sweating through the entire night. I wasn't sure if I had the flu or if there was something that I had ate that disagreed with me.
Over the next week, his symptoms intensify. His muscles are so tight that he can barely walk. His bones even seem to ache, and he's experiencing chronic diarrhea.
I knew that there was something wrong with me, but I wasn't quite sure what it was.
I was ready to jump on the plane and go over because I was concerned that possibly he could not explain to them what his problems were.
After 2 weeks of suffering alone, Sean is completely drained and desperate for help. Eventually, he musters the strength to get himself to the local emergency room.
When I went to the emergency room, I wasn't quite sure how to explain what the problem was that I had. I was able to show by pointing to different parts of my body and trying to exaggerate my body language.
The ER doctors soon begin running a series of x-rays and blood tests in an effort to determine the cause of the painful symptoms.
There was nothing that he could conclude was wrong.
They assure Sean that he's most likely suffering from an extreme case of food poisoning and that he needs to give it time to run its course. But a month later, Sean isn't any better. Unable to bear it any longer, he books a flight home to Indianapolis.
It was time for me to go home and get myself well.
Surprisingly, almost as soon as Sean walks off the plane, all of his symptoms disappear. The excruciating aches and pains, the chronic fever, and the diarrhea. It's mystifying, but Sean isn't complaining. After 6 weeks of misery, he finally has his life back. He graduates from college the next year, healthy as he's ever been, and immediately starts graduate school. Then, when he least expects it, in the fall of 2000, a new symptom suddenly emerges.
I began to get a sharp sensation running down my leg from the top of my hip down to my knee and sometimes all the way to my foot. And so I went to the physical therapist.
The doctor believes that Sean has sciatica, a symptom of a problem with the sciatic nerve that runs down the lower spine. It can trigger extreme pain in the lower back, buttocks, and in some parts of the legs and feet. In most cases, no cause is ever identified, and typically sciatica subsides on its own.
I had a very positive outlook and thought that it was something that was going to pass.
And it does pass. While he still experiences occasional attacks, Sean soon feels like he has the sciatica under control.
I would usually take a regimen of ibuprofen for a few days or weeks to get the pain out of my system.
During his last year of graduate school, he's feeling healthy enough to try another study abroad program. This time, he heads to Buenos Aires, Argentina. But almost as soon as Sean arrives, he's completely distracted from his studies when he meets Gabriela.
For me, of course, was a really nice experience. I fall in love immediately.
12 months later, Sean and Gabriela are married. The happy newlyweds soon return to the United States and settle down in Indianapolis.
For me, it was a big deal. My life changed completely. The city is completely different. The culture is different. The language, of course.
It's an exciting time for the Kiefers. In 2006, Sean, now 29 years old, lands his first big job running a public affairs office for the government. Then they find out that Gabriela is pregnant.
And I say, well, Sean, look at this. I'm pregnant. I can't believe it. I'm so happy.
Throughout the pregnancy, Sean is feeling better than he's felt in years. But during the last month of the pregnancy, when he least expects it, the sciatica returns with a vengeance.
He tried to minimize the situation every time. Okay, everything is okay. I have pain, or I don't feel very well today, but tomorrow will be better.
But no matter what he does to try to alleviate the excruciating pain, it doesn't help. In fact, this time the pain is the worst he's ever experienced.
My hip felt broken, my femur felt broken, my legs felt broken.
Sean's greatest fear is that Gabriela will go into labor and he won't be able to help her get through the delivery.
And I knew that I was going downhill. I was very nervous, unsure of what I was going to do, and knew that I needed assistance immediately.
For more than 5 years, 29-year-old Sean Kiefer has been suffering from occasional bouts of uveitis, a chronic inflammatory eye disorder, and sciatica, a crippling nerve condition. In the past, he's been able to manage the excruciating leg pain on his own. But now, Sean is experiencing one of the worst episodes of his life, and no over-the-counter medication seems to be bringing him any relief.
All I knew is that I was in an extraordinary amount of pain, and I wasn't able to move.
To make matters worse, he doesn't think he'll have the strength to join his wife in the delivery room when she has their first child, just 2 weeks from now.
My wife was afraid. She was coping with it the best way that she could.
But just when he thinks he can't bear it any longer, the incapacitating pain goes away, seemingly overnight.
All of the symptoms that I had vanished. I didn't follow up because my wife had just recently come to the country, having a new baby and a new job. My hands were full.
Sean is ecstatic, and he's able to stay with Gabriela during the birth of their son, who they name Santi.
Sean helped me during my whole delivery, almost 20 hours.
Seeing the baby and holding him in my arms, it was a very emotional experience for me.
Over the next few months, the Kiefers adjust to their new life with Santi, and Sean is feeling the best he's felt in a long time. But 2 days before his 30th birthday, he wakes up with a sore throat. At first, he just assumes it will pass.
A day or two later, the symptoms got worse.
Sean checks in with the family doctor, who confirms that he has strep throat. The doctor sends Sean home with a prescription for antibiotics. But the morning after he finishes taking the last dose, Sean wakes up in utter agony.
I felt as though I was in a 12-round boxing match in a condition that I had never felt before. My hips, my Achilles tendon, my jawbone, my neck were so stiff that I wasn't able to move.
He immediately realizes that this isn't like the sciatica he's experienced in the past. Something is very wrong. But when he calls the doctor's office for a follow-up appointment, he's told he'll have to wait 8 days for the next available opening. Sean decides to just grin and bear it and heads into work.
With a new baby, I needed to continue to work. Getting in and out of the car was a process because I wasn't able to bend my legs. There was a lot of pain.
4 days later, the pain seems to have tripled in intensity, and he's hit with a severe bout of diarrhea.
My body felt as though it had given up on me. It felt as though it had shut down. My hips and my groin muscles were so painful that I had to adjust myself multiple times during the night. I'd have to put pillows between my legs. It was impossible to sleep to the point that I was sleeping sitting up.
It takes everything in him to get to work each day, and when he's home, Sean can barely keep it together.
It was extraordinarily sad to want to bend down and pick up my son, knowing that if I would do that, I may fall over. And my wife would have to bring over the baby to me to hold, and even then I wasn't able to hold him for that long because of the pain of being in one position for too long.
I feel like, I don't know if I can manage this. I have to help Sean. I have to take care of the baby. I cannot sleep the whole night.
The family is at the end of their rope by the time Sean's appointment rolls around. And when the doctor finally lays eyes on him, he's shocked by the state Sean is in. After performing a thorough exam and going over every symptom that Sean has been enduring, he has a new hunch about what's been plaguing him.
He knew that there was a possibility of me having a condition called spondylitis.
Spondylitis is a type of arthritis that affects the spine or backbone, causing extreme pain and stiffness. In the worst cases, the vertebrae fuse together, impairing a person's ability to perform routine activities like walking and bending. Next, the doctor orders an MRI to confirm his suspicion. For the following 3 days, the Kiefers anxiously wait for the results.
Because this last episode was so traumatic from what we understood, we were really concerned.
But when the findings finally come in, Sean's family doesn't know whether to laugh or cry. The MRI is normal. The doctor is baffled, and whatever Sean is suffering from remains a mystery.
He wasn't sure what it was. He gave me different medicines, the most powerful pain medicines possible, and it didn't help even 1%.
5 days later, Sean is at his wit's end. Determined to get some answers, he refuses to wait for another appointment. Instead, he shows up at the office and demands an explanation.
The general practitioner, not being able to come to a full conclusion on what I had, he recommended me to see a rheumatoid specialist. I knew that I was going downhill. I was in a situation that was desperate. I needed help, and I needed it now.
"30-year-old Sean Kiefer has been tormented by harrowing leg pains for almost 10 years. Now, he's in the middle of one of the most painful and debilitating episodes of his life. His family doctor suspects that he may be suffering from a serious condition and has suggested that Sean see rheumatoid specialist Dr. Michael Stack.
He was frustrated because he had had a number of joint issues and tendon issues.
He asked me very pointed questions centered around the pain, where it came from, the history that I had with this pain. And I told the doctor about my flare-ups, my uveitis.
There are times when things occur at different points in your lifespan, but they're all related, but no one seems to have put that together. So it's like a puzzle where you look at the history and you look at the individual and you say, does this fit into one unified explanation?
After performing a thorough medical history, Dr. Stack is beginning to formulate some ideas, but his next step takes him into the lab. He needs to ascertain if Sean carries a certain gene marker, human leukocyte antigen, B27 or HLA-B27, which is associated with autoimmune diseases like arthritis.
The doctor suggested that I get tested for this gene.
It's a pivotal moment in the investigation. If Sean is a carrier, Dr. Stack should be able to zero in on a culprit. After a few anxious days, the results come in, and they confirm Dr. Stack's suspicions.
He had had a positive blood test for HLA-B27. And so we know that there's a high correlation between this gene and certain disease states. This was rather classic. We had a long discussion, and I said, all information we had, all the clues, all the symptoms we had, are best explained by a single disorder that would be Reiter syndrome.
Reiter's syndrome is a disorder that causes three seemingly unrelated symptoms: severe arthritis, inflammation of the eyes, and gastrointestinal distress. The illness is also referred to as reactive arthritis because the symptoms occur as a reaction to a bacterial infection that started elsewhere in the body.
He developed diarrhea, and within 3 or 4 days after, he started developing the arthritis. Why would it pick on the joints? And that's the question we do not have the answer to. And it depends upon maybe how much your immune response is to that certain bacteria, whether it's going to be a long-lasting immune response and eventually involve the eye, or whether it's going to be a short response.
In Sean's case, Dr. Stack suspects that the flare-ups occurred as a direct response to a bacteria present in his system at any given time, making Sean's symptoms seem to come and go over the years, and also making it almost impossible for any of his previous doctors to pin down his diagnosis.
Making a diagnosis is very difficult because the symptoms may be widespread over a period of years. And unless you can put them all together in one little package, you will be unable to make the diagnosis.
Despite the fact that he's just been diagnosed with a serious inflammatory disease, it's a watershed moment for Sean and his family.
It was a great sense of relief to find out that it was Reiter's and not spondylitis.
This was the first time for a long time that I hear him relax.
You could just tell that the weight of the world had lifted off of his shoulders.
And it's not lost on anyone how lucky they are to have identified the disease before it did permanent damage to Sean's joints or his eyes.
There's no magic test you can say, boom, you have Reiter's. It's always about the clues.
There's no question if I wasn't diagnosed that I would have continued to go downhill.
Reiter's syndrome can be very bad. It can be a disabling disorder if not diagnosed and treated efficiently and promptly.
Sean is immediately prescribed a regimen of anti-inflammatory drugs to control the painful flare-ups. He will most likely have to take them for the rest of his life.
Within 3 or 4 days after I started taking the medicine, about 50 to 60% of my pain decreased.
Today, Sean is healthy and active, and more importantly, he's become the father he always wanted to be. While Sean knows that he may have passed the disorder on to Santi, he will have to wait until he is old enough to understand all of this before testing him for the gene marker HLA-B27.
So if he does have these types of symptoms, that he's going to be armed with the knowledge to know what to do with it.
For almost a decade, it was clear to everyone who knew Sean Kiefer that he was suffering from a debilitating medical phenomenon. But it took more than 10 years for Kirsten Larson to convince anyone that she was even sick at all. In the fall of 1995, 11-year-old Kirsten Larson was beginning middle school on Staten Island. She was a typical adolescent, looking forward to her new classes and spending time with her friends. While Kirsten weighed a bit more than the other girls, she was never bothered by her extra pounds.
I would always be considered the chubby kid. If kids were 60 pounds, I'd be 80 pounds. If when you're normally 100 pounds, I'd be 120 pounds. I was never obese. People never thought it was something to be too concerned about. We do have chubby genes in my family.
I tended to expect she would probably have a growth spurt and more like baby fat that would go away.
But by the time winter rolls around, her mother begins noticing some alarming patterns in her daughter's stamina.
When Kirsten would physically exert herself, it might have been something as slight as a few steps. She would complain of her heart racing, getting sweaty.
I'd always have this burning in my lungs. No one ever knew what I was talking about.
She would be visibly pale. Sometimes she'd even seem disoriented. The sensation you would usually pass relatively quickly, but it was a very frightening thing to see.
As scary as these episodes are to watch, Leslie assumes that if her daughter were thinner and in better shape, she wouldn't be suffering from these symptoms.
Our friends would be very mean, cruel. They would make jokes, make comments about her weight.
It made me very sad and angered me a little bit, but you also have to accept kids are mean, kids are cruel, part of growing up.
Over the course of the school year, Kirsten begins experiencing these episodes more frequently. They soon become a normal part of her every day, making it extremely difficult for her to even participate in gym class. Still, Kirsten seems to be the only one who grasps that something could be very wrong.
From a very young age, something inside of me told me not to do things. I would see a staircase and something would tell me, we'll go up the stairs very slow. My body, my brain, just something triggered it and said, don't do it. I'd sit on the sidelines and it would hurt. It would hurt not being able to partake in the activities they were doing.
I know it made her feel isolated, alone, and she hated that. But regardless, she was strong enough to know that she really couldn't push herself to do these things, because the few times that she did, she'd get very sick.
By the spring of the following year, Kirsten is having more and more trouble catching her breath, and her parents are becoming increasingly concerned. Finally, her mother takes her in to see the family pediatrician. He gives her a thorough head-to-toe exam and concludes that she's suffering from exercise-induced asthma, a common condition that many overweight children experience.
We looked at him like he was crazy because I wasn't exercising. I wasn't doing anything. I was inactive. How can I have exercise-induced asthma?
Obviously, I didn't want to be told that she had something seriously wrong with her.
He is adamant that Kirsten's asthma is not severe enough to warrant an inhaler and suggests that she simply exercise more to strengthen her lungs. Kirsten and her mother leave the doctor's office somewhat perplexed, but take his advice to heart. Over the next few months, Kirsten diligently attempts to pick up the pace. She begins by jumping rope, but every time, no more than 10 minutes into the activity, her heart starts to race and she feels a terrible burning sensation in her chest.
I was trying to be good. I wanted to be active.
Nevertheless, Kirsten stays focused, and when the family heads to New Mexico for spring break, she's hopeful that she'll be able to hike La Luz Trail. But within just 10 minutes of arriving, the unimaginable happens.
We get to our hotel, and there's an elevator and there's a staircase, and they're right next to each other. And I said, hey, Dad, let's take the elevator. And the first words what he said was, don't be lazy, take the stairs, it's one floor. And I said, okay. And I take the stairs. I get this feeling in my brain, a tightness, this tense feeling, and I would feel that the walls were closing in on me and my brain was just being pushed in and the air was being pushed right out of me.
Kirsten got very dizzy, very, very pale. She started to sweat, started to shake. Her pupils dilated. It was a very, very scary thing.
Leslie takes Kirsten down to the lobby for some air. A hotel clerk notices and rushes over to the family. She assures them that Kirsten is experiencing a reaction to the high altitude. It's common in the hotel as they're 5,000 feet above sea level.
Which I guess made sense. New Mexico is very, very high up. A lot of people can't handle the altitude.
She offers her some bitters with ginger ale, and the home remedy seems to work.
In my head, I'm going, if we would have just taken the elevator, I would have been fine. Why did my body tell me that?
11-year-old Kirsten Larson has just collapsed in a hotel while on vacation in New Mexico with her family. She is starting to believe that something is seriously wrong with her. Over the course of the next 3 weeks while the Larsons explore New Mexico, Kirsten insists on staying in the hotel or camping out in the car.
That's how New Mexico went. We had all these adventurous things, hikes and trails planned out, all these places to go. I would say, I'm ruining that dream vacation. But it wasn't a dream, it was a nightmare.
The moment they return home, her parents take her to a doctor to find out what could be causing their daughter's frightening episodes.
And this doctor said to us, when you hear hoofbeats, we think horses, not zebras.
Meaning, think the obvious. You're a chubby kid, lose some weight. Don't think it's anything out of the ordinary when the answer's right in front of you.
The doctor puts Kirsten on the scale and then reassures her that if she drops 20 pounds, all of her symptoms will go away. Kirsten's mother is shocked by the doctor's frank diagnosis.
It said to me, "You're calling my daughter a big hypochondriac and me hysteric." This made me pretty upset.
Despite her frustration with the doctor, Leslie encourages her daughter to try once again to lose weight. She even promises to diet with her.
I didn't really want to believe there was something wrong.
Over the course of the next year, Kirsten begins to see changes in her body. Slowly but surely, she drops a few pounds. And for the first time in years, she's starting to feel like she can keep up with her friends.
I was counting everything and eating as much fruit as I could. I was trying to be good. I'd do sit-ups, and I started to feel okay. You know, I was able to do stuff on my time.
In the fall of 1995, Kirsten begins 8th grade, feeling more confident than she ever thought possible. But during the early part of the following year, Kirsten is shocked by a frightening incident that happens when she least expects it.
My teacher decides that this one lovely first spring day, we're gonna take a walk. So he takes us for a walk around the block. And we had walked maybe 4 blocks downhill. I was fine. And we get to the bottom of the street, and all of a sudden, my brain says, no, 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 do not walk up this hill. Do not do it.
She just stopped dead in her tracks and wouldn't move further. And everyone looked at her and said, "Come on, Kirsten, you've got to be kidding me."
And we get 20 feet from the door, and I say, "Oh, I don't feel good," and I do this whirl, and I just fall flat on the ground and hit my head on the concrete. The head administrator of my school was an EMT. He gets out his EMT kit. He does a quick listen. He says, "Wow, your heart's beating really, it's not fast, it's hard, it's pounding. But, I guess you're all right, it's maybe allergies. Spring, everything's falling and blooming, and that's what it is, it's allergies."
As soon as Kirsten's mother gets word that her daughter has collapsed yet again, she races up to the campus. When the school administrator walks her through what happened to Kirsten, she accepts his seemingly plausible explanation, but she promises herself that from now on, she'll keep a close eye on her only daughter, just in case he's wrong.
I kind of had in the back of my head that this just isn't right. This just isn't adding up. This just isn't normal pre-adolescent behavior.
Leslie soon begins volunteering at just about every school event. She's determined to make sure she's around if Kirsten has another episode. And when her class takes their annual trip to the Statue of Liberty, Leslie Larson is one of the first mothers to sign on as a chaperone. But at the time, she has no idea that the seemingly ordinary trip would turn into the most terrifying day of her 13-year-old daughter's life.
It's a crowded day, like it always is. I start out by going normal, walking up the stairs every step like a normal person. And I start to get slower. And then the tightness on my head, it's like someone's cranking it and just making, putting my head in a box. And the burning in my throat, it's just killing, and your heart starts to pump. With every step I take, it's getting worse and worse.
She was telling teachers, "I can't go any further. I really cannot go upstairs," and being very adamant about it.
And I'm going slower and slower and slower, and people want to pass me, but it's such a narrow area, and it's scary to look down that I said, I cannot do it.
She just became very frightened. White knuckle grip on the handrails was, I have to get out of here.
And people are just saying it's because I'm lazy, and it's not the answer. So that was heartbreaking.
Seeing Kirsten pasty white and sweating and shaking and just not my girl. There's just something so wrong with her. Why isn't someone paying attention to me?
And I said, "Please, can we go see a doctor? Something's just not right."
Eighth grader Kirsten Larson has been experiencing near-fainting spells for most of her life. But one day during a school trip to the Statue of Liberty, she and her mother finally realized that these spells are far more serious than either of them ever imagined possible. In a state of panic, Leslie rushes Kirsten in to see her old pediatrician.
She really listened to every part of me. She's using a stethoscope, but she's just, she's listening and she's taking her time.
For the first time in 13 years, Kirsten and her mother are hopeful. Someone finally seems to be taking her health seriously. But they're completely unprepared for what the doctor has to say.
The doctor seemed to have heard a heart murmur. Now, that was the first time anyone said anything like that.
A heart murmur is an unusual sound that can be heard in addition to your normal heartbeat. While most murmurs are harmless, some can be a sign of significant heart problems.
I'm describing symptoms, and describing all the incidents. And she knows that's not normal. This kid's going through something, and her heart is pounding.
In that moment, the Larsons' world is turned completely upside down.
She said, this is beyond my area, and I'd like you to see Dr. LaCourte. You've got to get to see him, and you got to get to see him now.
Just a few hours later, pediatric cardiologist Dr. Michael LaCourte is waiting for them when they arrive at his office.
She looked like an adorable 13-year-old girl who looked perfectly fine. I assumed that she was going to be like all the other kids pretty much I'd seen that day who would have basically nothing of any great concern.
And I go in, and he listens to me.
Our job as pediatric cardiologists is to detect the difference between what we would call an innocent or normal murmur and a murmur that might be due to a blocked valve or a hole in the heart.
And his face turns white. He says, "Not right. This isn't good. I don't know what it is."
He came out of his office with a look of, I guess it was restrained horror on his face.
I just basically said, I think we've got a problem here, and that is when I made the decision that she needed a different level of care.
Dr. LaCourte believes he knows what Kirsten has, and it's not good. He immediately refers the Larsons to Dr. Robin Barst, a renowned pediatric cardiologist who specializes in rare diseases.
She was and is the person that everybody knows and sends children with this rare problem to because she's the most experienced.
Suddenly, the clock is ticking. Dr. LaCourte makes it very clear that Kirsten has to see Dr. Barst immediately. Her life is on the line.
There were a lot of words like incurable, rare, no known cause.
My parents are terrified. I'm terrified for them. Kids react to their parents' reactions, and I can only imagine what's going through their heads.
I don't even think I could explain how I felt.
In a state of shock, the Larsons rush across town to an emergency appointment with Dr. Barst. All the time, they are praying that she'll be able to help them understand the mysterious illness that Kirsten may be suffering from.
She was scared. She didn't know what was going on. She was a slightly chubby child, and I started asking questions about what her history was, what she was able to do, and in a relatively short period of time, even before we started to initiate the tests, I was pretty suspicious that she in fact really did have this very rare condition.
I started feeling a little feeling of dread right now. What have they found? What did they see?
Because the prognosis for this rare disease is so horrific, it's exceedingly important that we are absolutely convinced and are absolutely accurate about the diagnosis. We need to do an invasive procedure, which is a cardiac catheterization, to confirm the diagnosis. We push the catheters up into the heart and into the blood vessels in the lung. We can make pressure measurements. We measure the amount of oxygen in the different chambers of the heart.
But the crucial test can only be performed in the hospital, so Dr. Barst immediately admits Kirsten.
Kirsten had never been in the hospital ever in her life. Not tonsils, not for any reason. So that was scary. Scary for her, scary for me, scary for everybody.
Well, they tell me that it's a surgery I have to be awake for. And I said, what? And it's gonna take about 6 to 8 hours. What? And we have to go in through the groin area. What?
Internally, I was screaming, give me an answer. Tell me what is wrong with this child.
13-year-old Kirsten Larson has just been told that the burning chest pains and random fainting spells she's been having may be signs of a very serious and incurable condition. Now in the hands of Dr. Robin Barst, a renowned cardiologist who specializes in rare diseases, the Larsons are desperate to know what has been plaguing young Kirsten for her entire life. Terrified, Kirsten is wheeled into the operating room.
It's the anxiety which is most concerning. And we use conscious sedation. We give the patient something to relax them and make them sleepy, but we want them to be able to respond to us and still be awake.
Dr. Barst begins the 6-hour procedure.
They put me on the table and they put a hard plastic box over my head. It's so that I can't move, scream, or do anything, and to disrupt them.
It's an arduous half day in the OR, but at the end of the procedure, Dr. Barst believes she can finally confirm what's been causing Kirsten's problems all these years.
She had nothing wrong with the heart per se. There were no holes in the heart. All the blood vessels, everything had been formed normally, but she had very high pressure in the right side of the heart, which was making the right side of her heart very weak. You have to find out where the high pressure is coming from. It could come from a heart valve or someplace within the heart, but everything structurally was totally normal with Kirsten's heart. So therefore it means the high pressure is coming from the blood vessels in the lung. That by definition is pulmonary hypertension.
Primary pulmonary hypertension is an extremely rare lung disorder. The blood pressure in the pulmonary artery rises far above normal levels for no apparent reason. The pulmonary artery carries blood from the right chamber of the heart to the lungs. Patients who suffer from pulmonary hypertension have blood pumping through their pulmonary artery at more than double the rate of healthy individuals.
We think pulmonary hypertension starts by the cells that line all the tiny blood vessels in the lung. And so the lining cells go from being a nice smooth surface to something disrupts it. So then the muscle starts to close down on the artery, and the arteries then start to scar closed. So over time, the vessels go from being pretty wide open to being virtually totally closed. And so the pressure to get the blood through those arteries builds up, and it becomes extremely, extremely high.
This closure in the pulmonary artery puts an enormous and sometimes deadly strain on the right chamber of the heart, which must now work harder than usual to move blood through to the lungs.
And I get this feeling that this isn't going to be something that can just be fixed. This is going to be much more serious than we thought.
Pulmonary hypertension is probably one of the worst diseases that I know of. Children, more often, if they are not adequately treated, they can die from their heart rhythm becoming very chaotic. They can die from blood vessels in their lungs rupturing, and they just cough up massive amounts of blood. And what happened with Kirsten, she couldn't get enough oxygenated blood to her head, and so she fainted. Kirsten absolutely could have died during one of the episodes.
And she says, "Kirsten, I want you to sit." And she goes, "You have a disease called pulmonary hypertension. We don't know where it came from. We don't know why you have it. But I'm going to do my best to give you the best life that I can while you're here." So that was her way of saying, this disease is terminal and you're, not gonna have much longer to live.
She probably would have died within 2 to 3 years, maybe less.
Some days I might think of it as maybe the worst day of my life, that my only precious child has a disease that is not only rare, but incurable.
It's a devastating thing to discuss with parents.
On the other hand, I look at that day as being really pivotal, as being kind of special, because it gave us an answer.
Everything's rushing through my head. What if they had found it earlier? Why did these doctors brush it off so much?
I know what to do, and I'm focusing on a very limited disease. When you have someone, a patient, a child, or an adult, go to their family doctor or to their pediatrician with very vague symptoms, that's when it's really hard to make the right diagnosis. So if you're a physician and a child comes to you and says they get out of breath when they're running and playing track and field, it's not inappropriate to think that they have exercise-induced asthma.
The thoughts that went through my head of wanting to strangle every person that told me I was fat, that I was lazy, that I just needed to exercise more, when all that was doing was making it worse. Had I listened to those doctors, I would not be here today.
With the diagnosis in hand, now comes the tricky part. While there is no cure for pulmonary hypertension, there is one treatment that can slow down the effects of the deadly condition. Unfortunately, is not an easy reality for anyone to swallow, especially a young teenager.
The only approved therapy we had was going to be continuous intravenous prostacyclin. We think and we hope what the medicine is doing is at its best, it's melting away some of the scar tissue that builds up inside the arteries in the lung. It's very difficult, particularly to start a teenager on this medication, because this really is having a tube coming out of your chest with bandages and having a pump attached to you.
And I just cried, and I cried, and I cried. I'm like, I'm going into high school, and I'm gonna be this mutant. I'm gonna be a chubby mutant.
It was a lot to handle. The thought that how can you possibly have a preteen hooked up to a IV 24 hours a day forever? It was pretty overwhelming.
7 days later, Dr. Barst takes Kirsten back into the OR one last time to surgically implant the intravenous pump into her chest.
They put me out, and when I woke up, I had a tube coming out of my chest attached to a machine with medicine.
Within 24 hours, Kirsten feels better than she can ever remember. The burning sensations in her chest, the dizziness, the fainting spells have all but vanished.
And I was fixed. I did everything as a normal kid. I went to parties, I went to nightclubs. I felt great, so I could go out and be a normal kid. Being diagnosed, the first moment was horrifying. And then once I got the medicine in me, I realized that I could deal with it.
Today, 10 years since Dr. Barst first diagnosed Kirsten, she's graduated from college, she's been married, and she's producing a documentary about children like herself who have pulmonary hypertension. While her prognosis remains uncertain, Kirsten Larson is an inspiration.
All of us worry about little things, and she's worrying about the big things.
When I wake up each morning, I think I have to do something with it. It's a gift. It's an absolute gift. It's not that my life is going to be taken away from me. It's that I'm being given a gift every day that I get to be here.